following the issues that have been happening, I spoke with the health minister, and on his direction, we need to take steps to see how best we can have these issues resolved. So we came to meet with the union leaders to get their perspective and see how best we'll be able to resolve it. Thankfully, we've reached a resolution. However, they will make the communication themselves. So I'm sure that in the course of time, they'll do that communication. Once they do the communication, then we'll carry that from there. But we want to assure the public that Ashanti region is central when it comes to health delivery. But we carry the burden of both the northern, the middle, and the Ashanti itself. So if we have our only tertiary hospital breakdown in this manner, then most definitely it's going to affect us. So we're taking all the steps in making sure that these issues are de-escalated, most importantly. Because once it lingers on, is the patient that suffer. So that we'll be able to have that. So I want to thank the health minister, the union leaders for their cooperation in this whole issue, and thank the RCC team for joining us in this resolution. So we'll communicate the resolution to the health minister. The union leaders will also come out. Then, as soon as possible, we implement the issues thereof. So for Afari, Trader, and Oforuku, we are doing equipment installation. We have gotten some funds for the contractors so that they will do the finishing works in terms of the construction related issues. The regional health directorate is also doing a staff rationalization and deployment so that we'll be able to open it. As early as possible, we'll open it so that we'll be able to take off the pressure from Komfo Anokye. Beyond that, we are planning on, or we are working on a concept where we could have reverse referrals. So, say Tafu Hospital could not manage the situation, they brought the person to Komfo Anokye. We've been able to stabilize the patient for a certain number of days. Can we do a reverse referral so that the patient can stay in there and recover from there instead of adding to the numbers over here? And also, we're looking at a concept where instead of referring patients here, can we refer our consultants there? Can we refer our residents there? So these are all issues we are looking at. So the health directorate is mapping out the region. After all these are done, you hold an engagement with the public and let them know that if you bring your patient to Komfo Anokye after assessment, you realize that you can let the patient go to, say, Tafu Municipal or, say, go to any of these district hospitals. It didn't look like Edward Bakasim and Asado coach. And get to understand that it is all part of the coordination to make sure we are not congested. But most importantly, the president and the health ministry and the health minister, we are working seriously on the Sewa trader and free.
You are a medical doctor yourself. Going forward, what should be done?
So communication gap, that is one of the coordination gap. These are the things that I identified, and I think that we're going to work more on that. For expertise and everything, I have absolute confidence. The only issue had to do with communication and coordination.